appreciate you being part of our webinar this evening. My name is Tim Smith, and I will be joined tonight by Michelle Witt for our presentation. Both Michelle and I work with CMHA Peel Dufferin, but tonight we're representing the Hills of Headwaters Ontario Health Team and many of our local community partners, including the Dufferin Area Family Health Team, Dufferin Child Family Services, Family Transition Place, and Hospice Dufferin. We want to thank you all for taking time out of your schedule to be here with us this evening. It is so important to still feel that community connection during a time like this. We understand the stress and anxiety that goes along with working in healthcare during such an unprecedented situation, and we thank you all for that. Thank you for all that you are doing for the community. Writer Ernest Hemingway once said, "Courage is grace under pressure." And it's safe to say that we have a group of very courageous people connected here tonight. Thank you again. Our topic for this evening is dealing with stress while working in healthcare during a pandemic, a big subject. But before we begin, I would suggest that you have a pen and paper handy, as there may be some points that you want to write down. If you can leave tonight with a nugget or two from our presentation, we will feel quite successful. We will also be sharing some resources at the end of the presentation that you may want to write down. Our objectives for tonight are to talk about what stress is and how it impacts us, learn a few things about the ABCs of stress management, understand how communication can lead to increased stress, and talk about some strategies to manage stress, and as I mentioned, provide some resources should you feel that some more information or some more support would be helpful. So we're going to ask of you tonight to take ownership of what you take out of tonight. As I mentioned, if you can leave with one or two pieces of information that you find helpful, that will be a really good night for us. We do have a chat function on the right-hand side of your screen, so if you have questions, please feel free to send them through to our chat room, and we will try to address them either via the chat, or if it's a really interesting or pertinent question, we'll bring it forward and talk about it live during the presentation. If you're not sure of exactly what we're referring to and you'd like an example, please let us know and we'd be happy to do that. And finally, we ask that you take care of yourself. These are unprecedented times. You've heard that phrase a lot recently, and it's really important. And what we're doing tonight is trying to provide the support and maybe a resource or two to help you look after yourself, because it's what you're doing is so vital and we want to try and support that. So our next set of slides are going to be covered off by Michelle.
Hi, everybody. So we're going to start with what is stress? So your body and mind's response to a real or perceived threat. The response is meant to get you ready for some kind of action or move you away from danger, so that fight, flight, or freeze response that you get. In today's world, these threats are mostly problems that need to be worked through, where in ancient times that could have been you're being chased by an animal, so that was a real threat, but now our threats aren't as dangerous as that, thank goodness. Good stress can stimulate and motivate you, like a job interview or getting ready for an exam that can motivate you to study more. But when stress is unhelpful, you may feel overwhelmed or trapped. Prolonged stress can overstimulate you psychologically and physically. Stress is a reaction to a situation. It is not about the actual situation. It's just how you're reacting to that stimulus. We usually feel stressed when we think that the demands of the situation are greater than our resources to deal with that situation. So learning some coping mechanisms could be really helpful for dealing with stress. Stress and COVID-19. What is this experience doing to me? So the prolonged freeze, fight, or flight response, the lack of a break from COVID-19 stimulus, it is everywhere. On social media, on the TV, people are talking about it. It seems like you can't escape from more and more information about it. Impact on our natural support availability. So those family and friends that we would lean on normally, go to that girlfriend's house and have, a glass of wine and have a chat. You can't do that anymore. Everything has to be virtual. So those hugs from mom and dad or other friends are just not available. They increase responsibilities at work and at home, especially for the essential workers. The amount of work that's been put on your shoulders must be very stressful. Increased risk of personal health issues. So if you had a previous issue already, it might be, the stress is just not helping. Natural increase in worry about loved ones, especially ones you can't see because of the isolation. And what routine? The routine of work or school, there's something you knew every day, when to get up, who you were going to see, when to have breakfast. Now that's all topsy-turvy. So how can stress make you feel? Stress, it affects people in different ways. So on this chart here is some ways stress can affect us. So some people have trouble concentrating. Some people may get stress headaches. Anxiety might get higher. Anger, the littlest thing might set you off. Stomach problems, fatigue, real tired. Lower in the sex drive, skin irritation, muscle tension, teeth grinding, apathy. You just don't care anymore about anything. You don't care to do anything anymore. So have you experienced any of the following? Changes in your appetite, either more or less. Changes in your sleep. A lot of people have been saying that they haven't had great sleeps lately, which then makes you fatigued. You don't feel like doing anything anymore if you're tired all the time. Exhaustion from being overworked, having to think too much, the anxious brain going and going and going. Irritability, being around your kids all day and your family in such close quarters, unable to get out or talk to anybody else. Anger, angry at the government, angry at just the situation in general, and just angry that you can't change anything. And comes with that is frustration. When will this end? Well, when will we be better? And then feeling overwhelmed. How do I handle this? How do I keep my family safe? And difficulty focusing and making those decisions because of all the things above. And then muscle tension. That's what happens when you're feeling stressed and you're holding yourself really tight. You start to feel that pain. What stresses you out? When we're looking at work life, it's just the change in general, moving from the office to home, or not working at all, or being moved to a different working environment to help others. Distractions, you're trying to work at home and your kids are being loud, or your husband's banging on the door, or the neighbor decided it's a great time to start building a deck. Feeling overwhelmed. So much extra responsibilities are now being put on your shoulders. Now you're a teacher as long as a mom and dad. Too many things on the go. How do I get everything done in the short amount of time that I have to do it? Deadlines, they tend to be shorter and shorter because the need is so great, especially for essential workers. Family issues. Some are not able to see their families and that's causing the issue, or some are seeing way too much of their families and that's the issue. Work relationships and morale. Without that, lunch table chat or that colleague to kind of talk to when feeling stressed, it's really being missed. And then the gossip, the stories, the false information that can be even scarier than what's actually happening. So you're in your home and social life, what's stressing you out there? Again, your relationships. If you're already kind of rocky in your relationships at home, now it's even worse because you're stressed and having to be together. Chores, there seems to be more of them. The kids always seem to be eating. There always seems to be dishes to be done or somebody who spilled something. Finances, some people who aren't working, who have a mortgage to pay and other bills, but the money's not coming in. And then your children themselves. You feel like they don't even have much of a life because you have to keep them in to keep them safe. No school, no friends. What do you do with them? Schedules. You keep trying to keep on a schedule, keep everybody going, but then they're like, what's the matter? We're not going anywhere. Why do I have to follow a schedule? And extracurriculars. So If you're used to driving your kids here and there and then everything stops, how do you keep those active kids keep going and keep your brain sane? In time. You don't even know what time it is, what day it is. That seems to be lost to this whole epidemic. What else? There's lots of things stressing us out in our home lives. Just the feeling of what purpose do I have on a day-to-day basis?
Thank you, Michelle. I will take over for the next few slides and talk to you about the AAABCs of stress management. Alter, accept, avoid, build, and change. Alter the stressors. Things that you can do to try and change how that stress is impacting you. Talking it out, speaking with loved ones, trusted people in your life, having the ability to share how things are impacting you, which leads obviously to having the ability to communicate, to try and impact how the stress is touching your life. Rescheduling and managing your time. We don't have a lot of control right now. There's many things that we are told we have to do and many responsibilities we have to take on. So some of the ways that we can regain control is to better manage our time and to reschedule the things that are less important. Prioritizing those things that are important and pushing aside the ones that are less important. And organizing what time we do have, especially after a long day at work and a tough shift, going home to some organization as opposed to chaos really helps to change the level of stress that we feel. And as mentioned, asking for help when you feel you need a break, when you feel you need a different perspective on an issue, on your stress, speaking to somebody you trust is truly an important way of dealing with stress. And certainly simplifying your life, which talks about rescheduling, talks about organizing and managing your time. Try to simplify, try to make things less challenging for yourself. The second A, avoid the stressor. Really hard to do in our current environment. COVID-19 is kind of everywhere. It's in our work life, it's in our home life. You can't turn on the TV without seeing something about it. So it's really hard to avoid. So we have to take little steps to make a change to help us deal with the stress. Saying no to things that you can, things that aren't a priority. Removing yourself from negative situations where things are challenging. If you don't need to be there, remove yourself and take a breather. Focusing on the things that are important to you will help to keep you clear on what you do need to do and help you push away those things that are less important. Knowing your limits, when do you reach the end of your rope? I've heard a few people use the phrase recently that, I just need to tap out for a little bit, which means that you're not giving up and you're not walking away. You're just taking a breather and you'll tap back in when you can. But sometimes we need to give ourselves that permission to tap out and take a breather. Avoiding the stress sometimes means that we just need to put our head down and talk about it later, do what we have to do in the moment, and that's okay. But if we don't deal with it at a later point, if we don't express ourselves, if we don't let go of some of that stress, it does build up. So certainly if you can't avoid the stress in the moment, talking about it later will certainly help to reduce the impact of that stress. And remember that emotions are contagious, both negative and positive. We all know that if we're in a situation where there's a number of really negative people that are talking about all the bad things that are going on, it makes us feel that same way. Conversely, when we're in that room with people that are laughing and joking, we can't help but smile along with them. So put yourself in those situations where you can pick up on the positive energy from other folks and try to avoid those situations that you can, that you feel are negative to you and your ability to cope in the moment. The last A rolls into the first B, accept the stressor and build coping strategies. These are some age-old strategies that you've likely heard before, but in a time like this, really important to remember and practice. Eating well, having a healthy diet, lots of fruits and vegetables, eating at regular times, not skipping meals, really important. Exercise, we know, is good not only for our physical health, but our mental health. The endorphins that are released after certain types of exercise are hugely beneficial for us and our ability to cope. Breathing, of course, we do it every day, every moment, but sometimes it gets away from us. Sometimes the stress of a moment can really impact us, and we find ourselves breathing heavily, getting out of breath. The rate of our breath really increases. And when you can catch yourself in that situation and really slow down, try and slow the breath down, try and catch your breath, really helps to deal with stress in the moment. Laughing and doing things for yourself, which would include hobbies, hugely important. Nurturing ourselves and nurturing the things that make us feel good helps us to cope. There are so many demands on our time, both at work and at home. It's hard to do. So we really want to encourage that you make that time, even if you have to book it into your calendar, if you write it on the fridge, mom or dad time from 8:30 to 9, go out for the walk, read a book, take that time to rejuvenate and reduce your stress load. In terms of building coping strategies moving forward, we want to set reasonable goals, which are typically, if they're reasonable, they're taking baby steps, they're small goals. We often talk about SMART goals, goals that are specific. You know exactly what you want to do. They're measurable, so you know when you've achieved that goal. They're attainable. You haven't set the bar too high. They're realistic in terms of it's important into your life. And a SMART goal is timely, which means that it's not something that you're setting a goal for 6 or 8 months from now, but for today or for this week. So setting up SMART goals for yourself and congratulating yourself when you can achieve those goals really helps us with being able to cope with stress and feel good about what we are doing. We've said this a few times already, but use your support systems. Talk to the people that you trust, talk to the people that you know have your back, and feel free to share how you are doing. Loved ones and friends, we all need each other, and we need to support each other. So when you're feeling overwhelmed and feeling like you need some help in coping, reach out and ask somebody for that. And of course, making time for spirituality, whether it's a form of religion, if it's your connection to Mother Nature, however you practice that part of your soul that you feed for faith and for hope, make time to do that. It's an easy part of our lives sometimes to push to the side because there's so many other things that are important. So we want to remind you that making time to practice your spirituality, engage in feeling hopeful and feeling that things are going to be well for you. And C is changing the way that you think. We sometimes get into some negative thought patterns, things like catastrophizing. You finish off the last bag of milk, and so now what are we going to do? The world's going to end because we're out of milk. But actually, maybe not. Maybe things are going to be okay because you still have juice in the fridge and there's water in the tap. So you can actually get by for a few days without milk if you have to. So it doesn't have to be the end of the world. So, if we catch ourselves in that situation where we catastrophize, we want to see if we can notice that and maybe challenge ourselves. All of us at some point or another overgeneralize. Everything's perfect or everything sucks, and that's often not the truth. There might be some bad parts to our day, but there might also be some good parts. So we don't want to use that really wide brush to paint our day. Jumping to conclusions can always be a dangerous thing, and something just to be aware of working within a really challenging environment. If we are gracious, if we are forgiving, if we don't jump to conclusions, it can help us cope a little bit better by not rushing to a negative outcome. And don't personalize things that are going on. There's lots of challenges, there's lots of bad news, and people aren't talking to you directly. They're not talking to me directly. They're talking about generalizations. So don't take some of that information personally. Allow it to be somebody else's responsibility. Own the things that are yours, absolutely, but don't take on the things that you don't have to. And challenge ourselves when we're blaming others. If there's a problem, sometimes it's nobody's fault, it's just a problem. And blaming others is looking to say it's somebody else's fault, that bad thing has happened and it belongs to you. And that can't help us deal positively with a stressor. So changing the way you think can change the way that you feel. That's an absolute. And if you feel better, you can change the way that you act. The Marubian formula, a really interesting piece of research that tells us that the way that we perceive people is based 7% on the words that somebody says to you, 55% of the perception is based on body language, and 38% is based on tone of voice. When you think of that, especially in our current environment and for some of our healthcare partners that are gowned and gloved and masked and visored, it is really difficult to communicate effectively when you think that really only 7% of what people are picking up is based on the words that you're using. So we need to be conscious both of the way others are perceiving ourselves, but also how can we pick up the cues about communication from somebody else if we can't see somebody's face, if their words are not necessarily as clear as they might be because they're wearing a mask and behind a visor. So the Marubian formula suggests that we need to be thoughtful about how we're communicating and what we are taking from communication. So we need to ask about clarifying questions. If you're not sure, don't assume, ask for clarification. To communicate effectively means that we have to show our interest in another person. We have to validate what they're saying, which sometimes happens through clarification, and letting people speak uninterrupted. Honor what they have to say, and hopefully they will do that in return. The language that we use also contributes to our stress level. Using the words but is always it's good, but I can help, but, and if we can take but out of our vocabulary and insert and. I can, and I wonder if there's another time that I could help you out because today I'm actually kind of busy. So it's not a no, it's I want to help, but we also need to consider something else as opposed to that but, which leads often to that negative response. And here again, we see the importance of listening to other people, giving people the chance to answer us when we're speaking to them. Waiting 8 seconds. It's actually a very interesting bit of advice that certainly we've been practicing doing so many virtual meetings. When you ask for feedback from other people on a virtual call, waiting 8 or 10 seconds to make sure that those people that might be waiting for somebody else to speak first, maybe that first person doesn't actually say something, so there's another person who is just waiting. So giving that bit of time can be really interesting and informative in terms of hearing everybody's voice and having really meaningful conversations. Another piece that's highly important in effective communication, especially when it's in a bit of a challenging situation, is to use I statements. Speak about your own experience and your own perceptions of a problem without using the word you. When we use the word you, we infer about something, the meaning behind somebody else's behavior, which we might have wrong. So we're always safer to use those I statements and speak from our own perspective as opposed to suggesting what other people are trying to say or what they mean. And at this point, I will hand it back over to Michelle. She's just going to let her jump on the screen.
How to prevent stress. Recognize and listen to the warning signs. Your body already tells you when it's getting too much for you. So looking for those headaches or those stomach problems, those lack of sleep, those are the signs trying to tell you it's time to find some time to relax for yourself. Use healthy coping strategies. Reach out for friends, go for a walk, just sit outside quietly. Stay physically healthy. We have the time. You might as well start that new exercise routine that you've been saying since January. Good time to jump on the treadmill, go for a walk outside, try a new exercise thing on YouTube. Eating healthy might be a good time to just look at your diet. Is there too much sugar or fat in it? Because that could be causing some of the low mood that you're having too. Especially if you're working really hard, you need to have a nutritious diet to keep you going. Getting enough sleep, which could be very hard when you have an anxious mind. So finding different ways to help you, whether you have to listen to some ocean sounds at night, some rain sounds, something that's going to just help you sleep. I listen to audiobooks, they put me to sleep. So those are some ideas there. Practice mindfulness and or meditation. Meditation changes the way your brain talks to the different areas of it. So it's so healthy to do anyway. So if you can find 10 minutes, you can go on YouTube and just say 10-minute meditation and something can come up with a beautiful ocean scene and it gives you a little mini mind vacation for 10 minutes. Seek support regularly. Reach out to these supports that we'll be talking about. You don't have to be alone. You don't have to go through it alone. And there's lots of people out there who have a lot of strategies that can help you. And reflect on the situation and learn from them. If something goes wrong, learn from it, take it as a lesson. If something goes right, learn from it, take it as a lesson. Make time for you. So the one thing that this COVID-19 has given us is the gift of time. Time to pick up those hobbies that maybe we've stopped or we'd always wanted to try. Sports and activities. Maybe you wanted to learn how to play tennis or you wish you could ride your bike more. These are some good times to try that. Ask for help at school and at home. Keep those connections strong. Make time for yourself. When you're in a house with so many kids and your loved ones and maybe your mom lives with you, you need to take that time out just for you. Some quiet time to do what you need to do for yourself. Have that warm bath. You know, watch your favorite show, read that book. Good enough is good enough. Not everything's going to be perfect. Clutter is going to happen every day because there's so many people on top of each other. Just be happy that you're all together. Consider no tech time. Doing a techie timeout would be really, really great because all the social media is just giving us a tsunami of negative information. So just giving yourself some time to step away from that and be mindful of how you're living every day. If you can volunteer your time, that's fantastic, whether it's just online or whether you're actually going out and dropping stuff at people's doorsteps or working at the senior's home, whatever you're doing, you're giving back always makes you feel good. Spirituality, feeling a connection to something that's outside yourself, feeling grounded, whether that is for you something that's religious or whether it's just spiritual, whether it's nature, whatever it is for you that grounds you and makes you feel at peace, engage in it now. Connect socially, electronically, have those little group Zoom days with your friends. You know, reach out on the phone and chat with that person that you've been meaning to call for a while. Take this time as a gift. What you can do. So here's a list of things to maybe write down for you. Start doing. What am I going to start doing now? I have this time. I'm going to start doing this. What am I going to stop doing? Maybe I have a bad habit I've been thinking about stopping, and maybe it's a good time to lower the sugar in my diet or start that walking. Continue doing. Maybe you were already meditating. Let's continue doing that. It's just going to be helpful. Do more. See what else you can do for yourself. Spend more time with your family. Do less. Worry a little less about maybe vacuuming every day or getting that laundry done, if that means that you can sit with your kids and play a game, or do it differently. Maybe that wasn't working before, those hours, whatever. Just change it up. So the local supports for you. Local providers have created a direct referral process for healthcare workers. If you go to a DCAP website, mental health workers on the frontline responders, which are like the health worker support staff, including the kitchen, admin, cleaning, other staff, hospitals, long-term care, retirement homes, group homes. If you guys need that support, that one brief session to talk to a counselor who can give you some coping skills, go on the DCAP site and book an appointment and we can have a chat.
Thank you, Michelle. I will jump in and just reiterate that is, it's a new opportunity to engage in services that has just launched in the last week. And we're very thankful to Dufferin Child and Family Services for hosting this portal to connect to healthcare workers. The counseling supports are being provided by a number of partner agencies, including CMHA, Dufferin Child and Family Services, the Dufferin Area Family Health Team, Family Transition Place, and SHIP. So we're very excited to be working together with these partners to provide counseling opportunities for folks that perhaps wouldn't necessarily require extra supports in a regular day-to-day environment, but through the course of living and working in a COVID-19 pandemic, it's tough and we can all use some extra support sometimes. So if this is something that would be helpful for you, please go to the DCAF's website, share the resource with your colleagues, let them know that there is an easy local way to get supports if it would be helpful for them. We've also put together a list of resources for you to consider as alternatives. Not everybody is comfortable considering connecting with local resources, and that's okay. There's not a wrong way to connect if you feel you need to connect. But what we can remind you of and support you with is that wherever you're working, you've got a human resources department. They can help direct you to the resources that are available through your employment experience. It could be through an employee assistance plan. It could be through benefits. But if you're not sure, please check with your HR department and they can help you. Your family doctor is always the quarterback of your health care, and health care includes physical health and mental health. So if you're feeling you might be struggling, if you have some questions about your coping, maybe feeling a little more anxious than usual or perhaps a little more depressed, checking in with your family doctor. They need to know about your entire health, including your mental health. So please connect if that's something that you feel would be helpful. As we mentioned, a number of local service providers are helping to participate in the portal through DCAFs, but we're also continuing to do all of our regular work. So CMHA, the Dufferin Area Family Health Team, Dufferin Child and Family Services, FTP, are all places where counseling has been accessible in the past, and it continues to be now. Some of the services are offering quicker access to brief supports, and you can check at any of our websites for more information or call to get connected. And this is where having a pen and paper might be handy to write some of these ideas down if it would be helpful. But Ontario Shores Hospital, which is a mental health hospital in Whitby, is offering free online counseling for healthcare workers. So if you go to the Ontario Shores website, it's fairly easy to find the counseling for healthcare workers. So we would encourage you to look at that option. Hospice and Palliative Care Ontario has put together a webinar series to support healthcare workers. They're in the middle of hosting those webinars, so there's some that have already occurred, and you can find the recordings online at their website. And there are some future webinars that you would be able to connect to live if you think that would be a helpful thing for you. COVID-19 Therapists, or the Ontario COVID-19 Mental Health Network, is a group of Ontario-based therapists and counselors who are registered mental health professionals that have come together to offer free counseling for healthcare workers. So the website is COVID-19therapists.com. And again, a wonderful resource for free counseling. And connecting with a counselor doesn't mean that there's anything wrong. It just means that you have somebody to talk to. And that's a key component of dealing with our stress. We've mentioned it a few times through the course of the presentation, and we really encourage people to talk. And if there are not people informally that you feel you can connect to talk with, then hopefully one of these resources would be helpful for you. The Centre for Mental Health and Addiction, CAMH in Toronto, is also doing some online supports for healthcare providers, and that can be accessed through the CAMH website. And the D'Souza Institute, it's based in Toronto, is also providing supports for healthcare workers by way of having online groups. So those are sessions that would be attended by a variety of people from across the province that are interested in that type of group support. And again, the website for that is www.d'souzainstitute.com. And if you get to their homepage, the other resources should pop up fairly quickly. CMHA Ontario has started the Bounce Back program approximately 1.5 to 2 years ago. And it's really a self-directed program at helping you cope with mental health issues, mood, anxiety, sleep, healthy living. There's a variety of topics that are available. I believe we have 21 different workbooks that are available. And you can order the workbooks, and when you do that, it comes with free telephone coaching. So it's a wonderful self-directed learning opportunity, free completely. It does require a doctor's referral. So if it's something that you'd be interested in, please speak to your GP or nurse practitioner. And if you want to see more information on that, the website is bouncebackontario.ca, or you could call for information at 1-866-345-0224. And we always like to remind folks about the Big White Wall. It's a website that offers opportunities for creative expression, opportunities to take some self-directed learning, self-improvement tools, some assessment tools, just to help people cope in the moment, to feel like they've got a place where there's no judgment and a sense of belonging while dealing with some mental health struggles and challenges. So it's a really interesting website. I've visited it a few times, and some great opportunities, like I said, for both creative expression as well as some learning opportunities. The Hills of Headwaters Ontario Health Team Collaborative is a pretty amazing group that is just starting to get traction, as many of you know. And the providers that help put this webinar together are partners with you within that Hills of Headwaters Collaborative, and we're really honored to be able to provide some supports in this really challenging time. We have a great deal of respect for the really challenging work that all the healthcare workers are doing on the front line, and sometimes in some very challenging situations. So we want to again say thank you very much for your efforts. We truly appreciate the hard work that people are putting in every day at keeping our province safe and healthy. And we would ask, as we close up, that you take good care of yourself, stay safe, and stay healthy. Thanks very much for joining us tonight. And stay tuned. We may look at doing some more of these in the future, and we'll certainly let people know if that's an opportunity we can take advantage of. So thanks very much, and have a great night.